Hello, good evening, and depends upon where you are. Uh, Colleagues from Southeast Asia, it may be a bit dark in the skies, and we're still trying to end our evening here. But a very, very special conversation today with psychiatrists from different countries as we approach the World Mental Health Day tomorrow. As you all know, the theme for this year is mental health in an unequal world. And our thought here was how about we bring learning from each other, best practices from each other, and see if we can implement that. And that's the true equality and equity, isn't it? I have some very special colleagues here from across the world, Southeast Asia, in fact. I have Dr. Eugene Ko, he's from Malaysia. He's a psychiatrist and senior medical lecturer at the Department of Psychiatry, Faculty of Medicine and Health Sciences. He's the founding president of Malaysia chapter of ACBS, University Putra Malaysia. Thank you, Dr. Eugene, for being here. Really appreciate this.
Thank you.
And we have, Dr. Jared, and I have been speaking now for the past 3 years, every year at least once. So when we used to talk to medical students. This time it's a community engagement. Absolutely honored to have you here. He's from Singapore. He's a senior consultant psychiatrist in emergency and crisis services, Institute of Mental Health, Singapore. So thank you, sir, Dr. Jared, for being here. Really appreciate. And then we have Dr. Sati Raja. There's a surname also. There's no way I'll be able to pronounce it. So he told me that you can call me Sati, and that's good enough for me. He's a psychiatrist in Pambala Batum General Hospital, Amuntai, South Kalimantan, Indonesia. What is intriguing is he's the only psychiatrist in a rural area with a population of 225,000 people. And his interests are in community mental health. And then we have our very own, very famous, young, dynamic, frequenting various news outlets and columns and just about finding time to be here, Dr. Vasant Ranganathan, who leads the Fortis Mental Health Services down south in Chennai. Thank you, Dr. Vasant, for being here. And I am Dr. Sameer Parekh. I'm a psychiatrist and I look after the Fortis National Mental Health Program. Let's just jump into it straight away and quiz in some of these fabulous minds. Let me start with you, Dr. Satya, and I'm going by what I can see on my screen, so I'll go and do a nice little ring roses. But my first question to you, COVID, mental health, the component of physical health and its integration with mental health, and both the inequality and the outreach. So share us your experiences about the interface of COVID and mental health.
Is it for me, Dr. Samir?
Yes, for you.
Yeah. Okay. So I think the situation has been overwhelmed in some times in Indonesia because we know that we are not ready for this situation, and the impact of this pandemic to mental health is so big, especially when people lose their job, or as well as with the isolation and lockdown and many things that related to the pandemic. And we all know that this COVID situation also
Okay, I think we may be having a bit of network issues. Sati, can you hear us? Okay, let me come back to you in a second. And let me take this question to Eugene. And I'm hoping that Dr. Sati would be able to join back immediately. Eugene, the same question for you. How has the COVID experience been in your part of the world and the interface with mental health?
I think that it would be quite similar over at your place and also where Sati was talking about. We have a very unique situation where we have multiple waves where the COVID would hit suddenly and it overwhelms some of our health system. and that becomes problematic because then we will have to deploy some of our psychiatric personnel to the front lines to actually handle it, and that in turn decreases our own manpower, and in turn it affects some of our services. So that's one of the main things that we tend to see that's problematic. But I think the rest is also cumulative. We have the same social problems of losing the jobs, economic problems, which results in terms more stress and increase in some of the common conditions that anxiety, depression. Burnout is a very common thing we do see, not just among frontliners, even those who are not deployed to handle COVID, actually do end up experiencing some burnout because of the, as I mentioned, the shift in manpowers. Um, Among our patients, I think with our new wave, we tend to see a marked increase in some of the anxiety and depressive conditions. A lot of it has to do with trying to go on to accommodate the new changes, especially our first few lockdowns were still okay. By the time we come to the third, the fourth, people were getting very tired, people were getting very stressed out. And now it's slowly emerging, the long COVID symptoms. We're getting more and more, we're seeing more and more of those kind of conditions, getting more and more referrals. And I think in the moving on to this very near future, we're going to see less of those stress conditions and more of these COVID sequelae. And overall, I would say it's a very dynamic, ongoing change, and I expect it to still change as time goes by as we handle COVID. And I suppose just wait and see how it actually evolve then.
Yeah, that's so true. Dr. Jared, your thoughts, how has it been? One, the interface of COVID and mental health, and are you seeing some more mental health concerns or some specific ones which have gone up post-COVID? Your thoughts?
I think the COVID crisis has really lasted very long. I think when we started in December 2019, those of us who are old enough to live through SARS, right? We know that was just a few months, but this has lasted so long, and I think the kind of cases that we saw has also evolved. I think at the beginning, I think there was a lot of lack of knowledge about how COVID is transmitted. We don't know its mechanism, how it works, how it spreads. I think there was a lot of uncertainty there, a lot of anxiety related to it. But then as time progressed, we know more about the virus and the transmission. We start to limit people socializing. We start to have lockdowns, and then that start to have a cascade effect on employment, on job security. I have got colleagues in Singapore who has family in India, and they haven't seen them for more than 2 years. We have got nurses who come from the Philippines. They haven't gone back home and see their elderly parents for 2 years as well. So I think that takes a toll on the mental health of people. And now we have people presenting with different kinds of mood disorders and anxiety disorders. But I think it's very simplistic to blame COVID for everything. I think there's also good that came out of it. I think there's so much effort on mental health, mental wellness because of COVID, that it sort of created this awareness, and people are more willing to step forward to seek help for their mental health condition. And we have developed online resources, telephone resources, and we are making mental health care so much more accessible. I wonder whether this kind of webinar will go on if not for COVID. I think Zoom, using video conferences are so common now, and that is accelerated because of the pandemic. I think it's a good
Yes.
thing. Not that the pandemic is good, but it's a good thing that came out of it. Yeah.
Yes, in fact, but Dr. Jared, that's something that I have also been talking about. Let me tell you that I've not done a physical consult now for a year plus. I've been doing exclusively psychiatry. Exclusively. I haven't, it's been February 2020, I haven't done a physical consult. And I do feel that one of the aspects, and I'll come back to the two of you as well before I ask Vasant this question, but I've also felt that it's actually bridged the gap also a lot more, because accessibility actually became accessible in its own way, because all you need is a smartphone to connect to somebody who may be a few hundred miles away. And some a concern which has been in Southeast Asia, I mean, let's accept it. Like when I was talking about Dr. Sati, I mean, one psychiatrist in 225,000 people. Now, if that is the population, and I was reading the other day the UNICEF report that low income countries versus high income countries, the difference between psychiatrists ranges from 2 in 1 lakh to 17, 1 lakh. I mean, that's remarkably, and that's inequality in its own way. But before we come back to some of these things, and let me tell you a very interesting audience that's listening to us today. I've got messages from young medical students, uh, and also from young budding psychologists and entrepreneurs in the field of mental health, and all of them are sending their messages and questions, and feel free to add them. I'm making sure, going to make sure that we ask this. I have to ask this to you, Vasant. We were talking about anxiety disorders, depressive illnesses. I want to ask, have you seen specific kind of post-COVID mental health sequela which you think has increased, Dr. Vasant? And then I'll go to Dr. Sati again, please.
Yes, sir. I think post COVID, there has been a surge in the anxiety symptoms that I have seen, stemming not only due to the various social and psychological causes that this pandemic has brought in, like the economic letdown and or losing somebody close by, or having gone through COVID themselves. But apart from that, people who have had this infection recovered, even then, after a couple of months, they start reporting of sleep disturbances, anxiety symptoms, episodic palpitations. So this is as you were rightly saying, within this pandemic, this mental health is another ticking bomb, or it's a pandemic in itself, and that needs to be addressed. And we should be aware and equip ourselves as mental health professionals to deal with that, because the pandemic is just not ending. For us as mental health professionals, it's just begun, and we'll see a surge of cases now with the recovery improving.
I think that's a very, very insightful comment, Dr. Vasan, that for mental health practitioners, the pandemic will now begun. Because right now we were so focused on the physical component, and now the mental health sequela is coming. Dr. Sati, coming back to you, I want to understand this. How have you been able to integrate digital psychiatry, or have you been able to do that? Please feel free.
Uh, I can hear you clearly. Please repeat it again.
So what I was asking was, telepsychiatry, have you been able to use that,
Oh,
given the fact that there is so much of deficit as well of
yeah.
experts?
Uh, 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 Telepsychiatry is a new thing in Indonesia, and it started since this pandemic, and we are not familiar with this thing until this pandemic. The Indonesian Psychiatric Association, they make a regulation about telepsychiatric, and a telepsychiatric itself is it's a must in this situation for all hospital in Indonesia, but not 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 every hospital uh, think that this is the need for them, because the we they have difficulties to provide the system that met the standard of the regulation. So I think it's still our homework for provide the telepsychiatrists that met the standard from the Indonesian Psychiatric Association, because it have to met the ethical legal standard, because we in Indonesia we can do telepsychiatry uh, in inside outside the mental health facilities. So only in mental health facilities we can do the telepsychiatry.
Okay. What about you, Dr. Jared, in Singapore? How have you been able to integrate telemedicine? And was it there pre-COVID also, or is it a post-COVID thing for you?
Um, it was, I think it was already there pre-COVID. We were still doing some telepsychiatry consultation, but there were a lot of rules and regulations and this and that. But because of COVID and the need to ramp up services quickly, I think the government very quickly revisited some of the rules and regulations and allow for a little bit more leeway. Like, for example, in the past, we couldn't use Zoom or WhatsApp video or anything. We have to use a secure software from a particular company to do it. But I think now with the advent of all this video conferencing technology, we could do it a bit more easily. In the past, we used to do this in Singapore. We have got nursing home, elderly homes. We used to only do teleconsultation with them, but we are doing it with everybody now. We do have some peculiarity, not peculiar. We do have some rules here. Like for example, we strongly discourage the first consultation to be done on telehealth because we still think that a physical examination is important in mental health. So the first visit we still prefer to be a face-to-face where we can do a physical examination, order investigations, and then subsequent visit we can arrange for telehealth. This is something that we have been doing. I mean, certainly for emergency situation where I work, we can use telehealth to do a crisis intervention, a crisis assessment, but we will still require the person to come in and then we can do that medical part of it. Yeah.
Yes. But Eugene, Malaysia, was it there earlier, or has telemedicine been a more recent thing post COVID?
We already actually have the legal framework since 1997, but it wasn't picked up. It has always been very slow, intermittent, and then COVID hit, and I think the medical councils, they have already came up two separate guidelines. We were slightly different, even though they were guidelines. It wasn't legal. The legal framework was just on how you could practice it for as a licensed practitioner, and also about consents. So when COVID hit, and we still see people run telemedicine without proper guidance or without proper structure. We saw more of it at the very beginning, and it was messy. I've heard horror stories about boundaries crossed and consents issues and all this, but it's getting much better. It's getting more organized. I think most of the institutes have started picking up and figuring out kind of how to go around with the framework. I do agree with what Dr. Jared mentioned. This is something I implement in my own hospital. We don't allow psychiatry consults for the new case, for the first consult, because I agree it's not just physical assessment. Even the risk assessment should be done properly as the first consult first, and then only see would they be suitable for teleconsult at the subsequent. However, as I mentioned, because there isn't a actual fixed structure, I don't think all institutes in my country would follow that same rule. And we do have a lot of autonomy on deciding on how we actually go about with it, as long as it follows the legal framework on practicing
Yes.
guidelines. And yeah, but it will build up. I do think that this is something that's going to build up and evolve. There are talks and there are rumors that they want to make it to a more structured, more safe practice. And then this is not just even for telepsychiatry, I mean, across the board for telemedicine in general.
Yes, I completely agree. In fact, if you ask me, then I feel that so in our country as well, pre-COVID, we didn't have telemedicine per se, not just telepsychiatry. But I think having telepsychiatry has been an eye opener because we're a vast country, a huge country, and the deficit of experts continues to be there in Southeast Asia. Like I mentioned, it's a reality. So what it has done is it's actually brought both accessibility and cost drastically. So let's say somebody living in a distant rural belt who would have not had any access to a psychiatrist like Dr. Vasant or yourself, any one of you, and now that individual could actually, over a simple video on their phone, have an access, can get intervention, and they will not have to the human cost of travel, the human cost or the economic cost of missing work days, all of that has also been impacted in a very positive manner. Your experiences, Dr. Vasant, you've been doing a lot of telepsychiatry, so
Yes,
how do you see it shaping up?
right. The accessibility issue that you were talking about, I was about to mention that a lot of my patients who come to me are from a very rural belt. So to reach my clinic, they'll have to hop in or change two modes of transportations. And during the COVID wave, many a times the public transports were either stopped or they were very minimum. So the accessibility was a very big issue. So at that point, when it was at the peak, when we were at the main pandemic, the height of the COVID wave, at that time, a lot of my patients preferred, and even now for reviews, they prefer to visit me online. They say it's much more easier. It is from the comfort of their home, and many a time I'm able to talk to the family better because the caregiver usually does not accompany. As you said, it's like loss of their job or livelihood for that particular day. So it's only the patient who travels and comes, and invariably his wife or his mother or other family members, they do not accompany because it just adds to their travel costs, and plus they miss their working days. But now with a single call, I'm able to meet the entire family and seek the prognosis or what changes have happened, or elicit the history in much more detailed manner in which the patient might not tell me. So I feel that it is like we getting into the home and eliciting the history right at where it is happening, and looking, we get a first hand view of the family dynamics that is there and how they are shaping up in the house. So that is definitely a big boon. And I think telepsychiatry is here to stay, and it is just going to grow further and further even after we've come out of this.
Yes, I do feel that it does bring in a sense of it just it does bridge that gap. I don't think there's any doubt about that. Let me add one more dimension to this conversation, and there'll be a bit of fluctuation, but I'm very much here. So it's you'll be able to hear me and probably see me in a slightly strange experience. And since you're all psychiatrists, so I'm sure you won't be concerned about it. And you'll realize, see, there it goes. And all of your smiles and my lights came back. So, uh, my question to you is, and let me also say that we have a very, very well known senior, almost legend in our part of the world, Dr. Aruna Bruta. She is asking a question from there. And very, very well known psychologist, one of the senior most in our part of the world. Um, so let me take that question to you because that was my next question, and I want all of you to give me a thought process on this. We have a deficit of experts in all our countries. So obviously, even if we shift to telepsychiatry, eventually we will still have need more layers. So what is the solution to bring in equality in the true sense, at least in the primary care of mental health? Um, Starting with you, Dr. Sati, you're one in 225. If actually everybody starts calling you and comes to you, you won't sleep for days, and then you'll become like me, and all this
No,
youth of yours will be taken away, and you'll start looking like me.
no. Yeah, our Ministry of Health is trying to empower the general practitioner in primary care, and also we uh, integrate with psychiatric nurse to for early detection, early intervention. So, and then psychiatrist will be the what we call it the for them. So it's become a national the Ministry of Health. Indonesia is an archipelago country, so there's so much area in Indonesia that there's psychiatrists at all. So I'm the only psychiatrist in this area. It's took for hours from our town to of the province. So I think we need to the Ministry of Health has an action how to empower uh, primary care and the general. So it's I think the most affordable thing that we can do in this situation. Doctor, thank you.
Yes. Dr. Jared, your thoughts. How does one take mental health, given the fact that we have a deficit of experts across the board? So, what are the solutions? I mean, are there any policies, any practices you are doing in your country, in
Okay.
Singapore, that we can learn from?
I think it's pretty similar to what Dr. Sati said. We are trying to empower the primary care physicians to take on mental health cases. So we do have got special diploma training for them, and we have close partnership. In fact, I mean, one of the other use of telepsychiatry is that we actually sit in virtually with the primary care physician when they see patients in their clinic. And then we do on-job training and tell them that maybe you should have asked this question this way, maybe the prescription, the titration of medication should be this way. Of course, after the patient leave the room, but then we will see the mental state, and then we'll ask the general practitioner to report to us what he thinks the mental state examination is. So very similar to medical students, but at a more advanced level. The other thing which we are trying to focus now is about prevention efforts, mental health promotion. So I think one of the things that came out of, again, something good that came out of COVID is that the whole population became very aware of the issues of mental health. So there is, in Singapore, we form an interministerial work group involving health, education, um, our social and family development, and we even got connections with the legal services, the law enforcement services to come up with a comprehensive plan. I will not say that we are there. We are definitely not there, not even close, but we are getting there. So one of the things which we've been trying to do is to improve mental health literacy in the schools. So we are partnering with our Ministry of Education to be able to talk about mental health issues even among children. I'm not sure in India, Malaysia, or Indonesia what's the phenomenon, but we are seeing younger and younger patients. I'll tell you, I work in emergency, and just a few months ago, I was reading a suicide note written by an 11-year-old girl. I have a daughter who is 11, and to read a suicide note written by someone my daughter's age is very sobering. It really reflects the kind of issues that we're facing in the country these days. So I think we are also targeting the schools to try to promote mental wellness and really get them to support each other. I think this is what we are trying to do. Like just one of the things we are trying to do. Yeah.
Eugene, your thoughts on this? And
Well,
are you in Malaysia?
yeah.
What are you doing about this? Because I think the deficit of experts continues to be an issue there as well.
Right. So there's a few things you need to understand first. Malaysia's deficit of experts is very imbalanced. We do have certain urban areas who are relatively okay, and the rural areas who are very, very deficit. Most our main framework is similar to Sati, is similar to Jared. We do have primary care who are somehow able to carry out basic mental health care. I'm not going to comment about the national one. I'm just going to share about what me and another team of mine whom I work with are doing. This is something we've been doing the last 2 years. We try to bring primary care and prevention beyond medical line. So we are not only empowering nurses, we're not only empowering primary care physicians, we end up bringing in village heads or any mental health advocates within a particular village in the rural area where they might not have any psychiatrists or even their doctors might be insufficient. We empower them to figure out what they can do either from a prevention perspective or at least a screening perspective. That way, it allows them to kind of identify early identifications of any possible problems and then do the necessary referral or get the necessary early intervention. And the other thing that we are actually looking in now, this is still in the planning stage. We haven't carried it out. I think Dr. Samir, you mentioned about me being in sports and other things. Part and parcel of that training was to look into lifestyle. So I think this is another area we could look into it, focusing lifestyle management or lifestyle and behavior modifications to empower more primary kind of prevention methods. So these kind of lifestyles could bring on things like exercise, yoga, meditation, diet, sleep, simple things can have a huge impact on some of the major stresses that can eventually lead to more severe mental illnesses, the stress management, and so on and so forth. By targeting that, we kind of believe that it will have some impact, especially if you do it on a population ground level. It is going to help assist some of the deficit, and in turn, hopefully, that would have a roll down effect, and we don't get as much caseloads later. But again, this is the planning stage. We are not sure. We know this has been rolled out somewhat successfully in some other countries, but again, it's also still early stages. We're quite kind of excited to see where this will go lah.
No, in fact, it's interesting that all of us from different countries are virtually using the same language here and talking about the same solutions. We are talking about mental health at the school level, mental health integration and training at the primary healthcare level, and then utilizing of digital medicine because we realize that that's the only way. I mean, we will have to focus on prevention as well. Let me tell you what we are doing here. So we've written a mental health curriculum for that matter, as in our the Fortis National Mental Health Program. We've written a mental health curriculum, which we train any school that wants. We free of cost any school that wants. We train the teachers into a mental health curriculum. We use some specific modules, 5 modules, and the idea of those modules is to give basic mental health literacy. Alongside with that, what we've done is we've started this initiative of bringing psychological first aid to schools. So, training teachers and peers into that, and some life skill work we do, which is on assertiveness, study and exams. We do a lot of work on media literacy. I mean, in these days, and I'm going to come to the topic of social media as well. The impact of social media that we see from our side of the table, like all of you said, is is worrying. So we do a lot of media literacy work, have a helpline functional, so on and so forth. And I think that's the kind of approach. It's just that we need to figure a way to scale it up, ensure the outreach, and utilize the digital spheres because one on one we won't be able to find solutions to mental health, and we'll continue to be having our inequalities. Vasant, you were doing a bit of hide and seek with us, so now you're back. So you've
Yes,
been working with schools now with the Fortis School Mental Health Program for a while, and just when you were out and in, Dr. Jared was talking about this approach to school mental health, and so was Eugene talking about it. Same. So, your thought is investment by the society and educational systems, WHO, UNICEF, uh, into school mental health, one of the ways to reduce the burden of secondary and tertiary mental health. Do you think that's probably possibly a solution?
definitely. I think at this point, when we talk about empowering our the youth, the next generation who are there, then the school population is the one that we will have to target. So when we have to target them, then it is through these curriculums that we talk about, to reduce the stigma, to create more awareness. That is a very essential thing that we'll have to do. And I think in our department, as part of that, we also have our young mental health advocates, whom we encourage them to spread awareness through social media and other handles, so that the stigma associated with it reduces. So when the next generation, when they grow up and become adults, their attitude towards mental health changes completely. So they become more aware, and that's where this primary care really helps. So what we are training the physicians now, actually the children or the future generation themselves are well equipped to identify mental illnesses and signs of danger or predictors in case of mental illnesses. So I think that is very empowering, and that's what should be done right now.
Absolutely. In fact, I think what Dr. Jed was saying was very interesting. The presence of a psychiatrist digitally when a primary healthcare provider is doing early intervention as a method of training nursing. In India, I've been talking about our Anganwadi workers and how we can probably utilize that. But I do feel like what all of you are saying, schools where you know a child is spending what over a decade, so you have a safe closed structured environment, and if that structured closed environment can be utilized for bringing mental health literacy, probably it could help a lot. Let me come to you, all of you now. You're all way too young than I am, so a lot more internet savvy, and Dr. Jared was talking about children. Let me start with you, Dr. Jared. How is the social media interface with the youth in Singapore? I mean, is it very similar to how Dr. Vasant, our young psychiatrist, is? Never leaves his phone, always scrolling, doom scrolling and texting and doing this and status updates. Is it the same there, or is the
Yeah,
world a bit
it's
better?
nah, it's the same. I tell you, there are sometimes I go to a restaurant and see that was before COVID, right? I see a family of four, and all four people are on the phone. Maybe they're texting each other. I'm not sure, but all four are just looking at their own phone. So I think this is a common problem everywhere, and it's really very difficult to stop the children or even the adults from having access to the phone. I think social media, there are a lot of plus points to it, but certainly I do see a lot of issues with it as well. Recently, I just gave a talk to a bunch of school leaders about cyberbullying. This is becoming an issue here. I think the problem with that is that people can hide behind a veil of anonymity. They don't have to show people who they are, and that becomes an issue. Um, I think the other thing about social media is, I think, it's also part of this computer addiction, internet addiction that we've been seeing more cases of as well. And in Singapore, I think during last year and during this year, actually now it's happening now. Um, because of the COVID situation, the children have what we call a home-based learning. So they don't go to school, they attend all their classes, and they are always on a computer. You know, when they're in school, not in school now, they're always on a computer, and this gives rise to other issues. Again, we are starting trying to reframe. There's some good that come out of it. Uh, like for example, some agencies in Singapore are trying to partner with TikTok. I don't know whether TikTok is popular in your country, but TikTok videos, they're trying to use it to deliver bite-sized mental health educational materials to the young people. I'm not sure about the effect, but that is something that they're exploring. The agencies are now looking to capitalize on social media to do good as well. Yep.
In fact, let me tell you this. So we don't have TikTok here, but we
Okay.
do have various other similar apps. But to be honest, I have been a proponent of using all possible apps that we can, because there's no point of me speaking on an app which nobody is listening to. I'd much rather go and speak on an app where young people are there. Otherwise, what's the point? So all over, I mean, we've been making reels. I made a few reels yesterday, and learning to summarize it in 15 seconds. Challenge, huge challenge. But yeah, you find a way. If that's what is going to reach, then you figure a way to use it. So what we've done is we have a very comprehensive social media um, outreach. Uh, it's very difficult not to find us if you are using any of the social media platforms that are popular in India, because we will find a way to keep reminding people of mental health no matter what else is happening there. It was a good example you gave on TikTok that, you know, there may be a lot of embarrassing stuff happening out there, but in middle of that, if somebody can give you media literacy, that can actually make a difference. Dr. Sati, Baba, same question to you. Is there a difference in the usage of social media in terms of urban, semi-urban, rural areas, or do you think that now with smartphones and internet accessibility that's become same? And have you seen in your practice increasing concerns of young people coming to you with problems related directly to the use of social media, internet, gaming, bullying, like Dr. Jared was talking about as well?
I think in this a workplace in my area, that it it's not it has not been issue in psychiatric problems regard with the internet or something. But in Jakarta, it become a big issue in uh, uh, is, uh, air- post. So the addiction is become an issue we have to deal with. But in this in my workplace, it's not a big. It's not and I haven't met uh, uh, is related to the addiction or game addiction.
Dr. Eugene, same question.
I I can't comment too much about the children or the youngs because my exposure to them are very limited. They tend to be another subspecialty kind of in psychiatry.
Hmm.
Uh, but I can confess, and I'm happy to confess here, is that I think my wife has told me way too many times I spend too much time on the phone. So I do think that it's something some of us will experience it even on our own. Um, Over the years, I have seen this change in my clinical approach. Nowadays, we have to ask things like, if you can't sleep, have you been spending time 1 hour, 2 hours before sleep scrolling through social media? That never need to ask, and I never
Yes.
need to ask them a few years ago. That is become a norm now. In some of my health talks, we start talking things about social media detox. This has never been something we need to talk about 2 or 3 years ago. Um, and many other things. I think that now social media use itself has really become sort of ingrained in the multiple conditions, the depression, your anxiety, so on. They can cause a lot of problems, and it becomes a norm to kind of ask about them. But I do agree, as what Dr. Jared mentioned just now, social media eventually is a double-edged sword. It does have its uses, especially in the prevention sense. Um, I personally have started, I think about a year ago, trying to embrace this with another group of the team that we work with. We kind of create our own pages, um, out, outlets essentially for mental health. So we talk about mental health on it, and it does have some impact. We do see people writing in asking, "I might have this," or "I'm not sure about this. Where do I go and seek help?" I do think that does help people who actually need it. But on the worrying side, as already mentioned, excessive use, excessive time consumption on it, and being ingrained in many other psychiatric conditions, that is something that we would worry. Um, I take in comfort in the sense that a long time way before any of us was born, when newspaper was first published, they had the same problem. They were thinking that newspaper might cause social ills and problems. That's the very old story. So I like to think that social media is something similar to that. It's new, it's growing. We might change our perspective about it many years down the road. But at this point, we just haven't quite figured out what to do with it yet, and it is causing problems when we're not careful.
Yes. And in fact, what you just mentioned is something last night I was doing a live with a, um, you know, a young entrepreneur, and I was asked this question, that what is that one tip you can give all of us in our use of social media? And this is what I told him, Eugene, what you just said. I said, can you just switch off your cell phone and your digital interface just 1 hour before sleeping? And you start it after at least half an hour to 45 minutes of your waking up. If you can just do that much without getting too rattled, then probably you are still in a safe space and you will do well. But if you can't even do that, then well, that's a huge red flag for you, because it's getting the better of you. Okay, so what we've had 40 plus minutes of a conversation, didn't even realize that time flew that fast. So let me start winding this up for all of you. And some of you are into your night, as Vasant and I get into a latish evening, and Vasant and I will, he'll have his hot coffee, and I'll have my lemon iced tea, and then we'll continue with our work. But my question to all of you, and I'll start with Vasant here. Listen, what do you see um, in the landscape of mental health over the next year or so, as we all start gradually coming out of COVID? I mean, not that we're gone out of it, it's still there. But what do you feel? That's one. Second part, what do you think mental health professionals, especially psychiatrists, should be doing? Both those aspects. And are there any things that we should specifically look for and contribute, because at the end of the day, mental health practitioners need to contribute to the overall society. So I'll take that question to all of you, and learnings that you can suggest that can be used by any one of us and all of us to help the community. Starting with you, Vasant.
Um, the impact, as I was talking about during the beginning of our conversation, that though we are in the tail end or probably at the sagging part of the curve of this COVID, but regards to mental health, it's just begun. So we'll have to buckle up, keep our resources ready, uh, stay safe, be healthy ourselves, take care of our mental health, because the surge and the volume that is coming will hit you. It is not like a physical ailment where we do our examination, write down something, and say, take it for the next 5 days and it's done. No, we'll have to be, our profession is more empathetic, and we'll have to connect to the patient in a much more deeper sense. And that can affect us in return. So keep our resources buckled up. As psychiatrists, I think we should be ready to handle what is coming up. And if we are doing that, that is our greatest contribution to the society at large. Being there and taking care of mental health of everyone who've survived this pandemic, and they've come on to and meet us. So
Yes,
the key learning would be to be healthy and take care of our mental health first.
interesting, interesting, Vasant. That's very interesting. Let me go to you, Dr. Jared. Your thoughts. What do we, as psychiatrists and other colleagues in mental health, lots of psychologists listening to this, and I'm getting questions.
Uh,
Um,
okay.
your thoughts.
Yeah, so I think this COVID pandemic has really made people look at mental health issues. I think it forces us to confront their issues. Lah. And I think we have to, we see everywhere that the mental health wave is going to come after that COVID wave has died down, and we are going to have a lot more casualties. So we have to be prepared for that. That's what Dr. Vasan said. We have to keep the conversation going. We cannot let mental health be in the spotlight just because of COVID. And when COVID goes away, we stop thinking about mental health. I mean, look at the advances that we have made in telepsychiatry, for example, or the reduction of stigmatization. We have to keep those going as well. So I think that's what Dr. Vasan said. I'll echo his point. I think we have to take care of ourselves. I think recently I had someone ask me, so how do you mental health care provider look after yourself during the pandemic? I think it's not something that we talk about very much, but I think it's something that maybe we could even have an international collaboration about this as well. Caring for the carers. Yeah.
Yes, collaboration. In fact, the whole idea of this conversation was very much Vasant's idea that we must have more conversations across. And we realize that for me, this conversation reinforces the one fact that, well, cartography plays its own role, but humankind is humankind, irrespective where it is, and continues to have similar problems. And there are always going to be similar solutions, like it or not. If we do the right things in the right way, wherever you are, it's going to apply to all of us. Same question to you, Dr. Sati. What do you see happening in the near future? What can we do?
We have to continue what we have for, but we will raise the level of our effort, because I agree with Dr. Jared that the mental health will be big will be a big issue for everyone in around the world. So that what we have done is we have raised our level, and we and it's related to this year theme that have, we have to equality in mental health. So the next level how to make our service is to optimize, and equality in mental health can be accepted by all in our workplace. It's all, Dr. Samir.
Yes. Eugene, same question for you. What do we see in the near future? What can we do about it? Can we be
I
more
would
prepared?
Yeah, I would echo what Sati, Jared, and Wasan has said already. That is pretty much what I would see. I just add on one more point. Us as a psychiatry fraternity, the one thing that I feel what the pandemic has brought about is actually brought a lot of psychiatrists internationally much closer. Personally, in the last 6 months, I've been involved, in fact, with more collaborations from an international perspective, and that itself in turn influence how I actually carry out my own clinical work. And some of the policies and so on and so forth. And I do hope to see that continue to expand, so that there are going to be more networks, there are going to be more information exchange, there's going to be more collaborations among the fraternity or even with other fields. There are other fields in not just medicine, other medical or other sciences or other biological or even engineering on this. As long as we start being an open-minded, build on upon this collaboration, I think we can actually bring much more benefit. And that's the best part about this pandemic, is now people are more comfortable having sessions like this, going online, having this chat. Many things can be done. Geographic has limitations of geographic has shrunk significantly, and I do hope this expansion actually continue as we go on in the next few years.
Yes, I think that's so aptly put. So much positive has also come amongst all. I mean, I guess we are all psychiatrists, mental health practitioners. So what happens is that we somehow are able to still find the little bit of silver lining in whatever we see, and the glass invariably for us is always a bit full and rarely completely empty. And so much to learn, so much to learn. It's just a continuum. We've had lots of comments about how important it is mental health as a curriculum to be added in schools, something that we've all talked about. For those schools who are anywhere in the world, and if you want a training for your teachers on mental health curriculum, just drop in a mail, a direct message, any social media platform, or just a WhatsApp, whatever you prefer. Drop in a message, and we'll be happy to train your teachers. The Fortis School Mental Health Program is an initiative that comes out of compassion of people like Dr. Vasant, and that's available for anybody and everybody. You psychologists, psychiatrists listening here, all of you, there's so much to learn from what colleagues have said, starting with self-care, focusing on primary healthcare, realizing that digital psychiatry is here to stay, and looking at ways to integrate it, and looking at more collaboration. This was one attempt of ours to bring in voices from different parts of Southeast Asia and continue these conversations. We look forward to hosting all of you again and having more dialogues and learning more from you. Absolute pleasure. The very, very young Dr. Sati, thank you for being here. Pleasure. And more power to you. 1 in
I com-
225,000. I'll keep that. The number will stay with me. More power to you, young man. More power to you. Uh, Thank you, Dr. Eugene. Very insightful when you talk about the diversity of countries, urban, rural, semi-urban, and how relatable it's all for all of us. Thank you for your words, Dr. Jared. Always a pleasure. It's an absolute pleasure meeting you. We didn't know each other 3 years back, and now it seems to be that we bump into each other virtually every now and then to learn from each other. Thank you, Dr. Vasant, for facilitating this. Really appreciate this. All of you listening, World Mental Health Day is just a reminder, but mental health is every day, not just for 10th of October. Equality, equity is possible when there is priority and intent. Nothing in life is without values. Let values shine. And like we've been talking about for the last few days, choose actions that matter. Let us continue to choose actions that matter. Thank you. Thank you, everybody, on behalf of the Forest National Mental Health Program. Appreciate this. Thank you.